CMHTs for older adults are the backbone of SLAM's provision, and there are teams in every locality. Nicky Hetherton is a community psychiatric nurse at Lewisham CMHT.
So she's confused. Our role is to see people who are over 65, who have got things like depression or dementia or psychotic illnesses. We see people who are new to our service, or sometimes people who have come from the younger adult service who maybe haven't had contact with them for a few years. Often we get referrals from GPs and social services and people like the third sector, such as Carers Lewisham or the Alzheimer's Society, sometimes housing. Sometimes people phone up themselves or their carers, so we'll accept referrals from anybody at this team.
The team is made up of a variety of professionals.
We have a range of expertise that's brought from doctors, psychiatrists with specialist training, from nurses who've had a lot of experience both in general nursing and psychiatry, psychologists, occupational therapists. And as a doctor, I love working in a multidisciplinary team. It makes us think harder about the person as a whole.
His concordance with his medication.
The team run a duty system so that whenever a referral is made, there's always someone available to take the call.
Our team is really the first point of contact for people within Lewisham who need an assessment.
Following initial information screening, an appointment will be made to visit the prospective service user.
Have you any other concerns? I mean, do you feel the GP...
Most people are seen on a routine basis within 15 working days of the referral, and they'll be seen by one professional at home. That interview usually lasts between an hour and a half, and we do ask a relative or carer or somebody who knows the person to be available so that we can also get another view of what the problems are.
Jude came into contact with the team when her husband John was diagnosed with dementia.
When we found out that John was ill, we were all in a state of shock, really, that, you know, we weren't expecting the diagnosis that we did have. We were a bit, apprehensive. We didn't want other people coming into our life. We didn't know how it was going to work out, whether they were going to be intrusive. I was wary that maybe things would be taken out of our hands and John wouldn't be ours anymore. He'd belong to somebody else. It would be them that would be guiding us to do things.
For some people, that fear about losing their independence is a big factor. And also, I think for some carers, it's about whether we get involved if we'll take away some of that control. So it's important that we work with people to try and enable them.
The people that came into the house were all supportive. If ever we wanted to do anything, we would talk it over with the team, and if they thought it was a good idea, they'd say yes, or if they didn't think it was a good idea, well, they wouldn't say no, but you'd just say, that, well, maybe there's a better way to do this.
A significant part of the team's caseload involves working with individuals and families affected by dementia. Early diagnosis can be crucial in ensuring the best possible care.
11. OK, it's in the diary. Dementia can be around affecting a family and a person for 10 or 15 years, and it's very important that people get early diagnosis so that they understand the challenges they face and then get appropriate support throughout the course of the illness from their GP, from social services, and also from the specialist team in responding to their changing needs over time, managing behavioural difficulties as and when they arise, and making sure that we support people and enable people to carry on caring, because that's what families want to do.